Cutting Edge Pain Relief, the channel that teaches you how to biohack your pain and get back to doing what you love.
So the first thing we're going to look for is biceps, which pops up right away, right there in the center, in between those two peaks. It's right at the bottom of the screen. Let's take a look. Before we kind of get into all of this, take out the biceps, I can see it easily, good, clear. One of the things that we're going to have you do with a motion is eventually be able to try and take this arm and bend it. Yep, that arm. And then you're going to have that thumb come back towards me, but keep your elbow pinned to your body. Yeah, so that's scapularis, that's right there on the right hand side. Okay, so we're going to let you have that come back down and you can rest it down. When you do that, does that hurt to do?
There's definitely a
hitch in the giddy up?
Yeah.
Yeah, I kind of figured that from just the way that you're moving that gingerly. Okay. All right, so Amanda, if I can, let me have you give me a spray on the short end of the throat.
Closest to you?
Close. We'll pinch, you're gonna fill in 3. Ready? 1, 2, 3, and pinch. Start to feel that discomfort possibly in the next few seconds or so as we kind of get right there on that bicep. Right about now. Doing okay?
Yep.
Okay. A bit more into the same spot. Yeah, exactly right. Okay, so now what I'm gonna have you do is that thing that we talked about before, where you bend that elbow and you bring that thumb back towards me. Okay. It's okay. If you got it, that's as good as you got. That's okay. You don't have to do too much of that. Okay. One more time. And come back. If you could stay right there, that'd be great. That's perfect. Right there. Spray right there for me, please. Perfect. Pinch. Pressure. This is the one that we really gotta get after, and that's that supraspinatus. That's the one that should be able to lift that arm up. So that's Sorry, come across your face with that. Pinch on 3. 1, 2, 3, and pinch. A lot of pressure now. So is that one of the areas that kind of bothers you a fair amount? Yeah, that's what I think. Thought rather. It's one of the muscles that we know that has some issues here for you. All right, so I'm gonna come around and get the rotator cuff interval in that same space. Let's see what we got. Ready? 1, 2, 3, pinch. A lot of pressure right now. All right, I know that was a tough one, but those are the areas that we really wanted to try to get after to try to make that feel a lot better. Okay, we got maybe a couple more spots and we're good to go. Okay, we're almost there. I'm gonna have you turn a little bit more towards the TV so you're gonna be more onto your left side. Spray on the short edge of the probe for me, please. So what you're looking at right now on that far bottom right-hand corner is the part of the humerus. That little kind of like V that it makes is where the joint is. So we're trying to get to that space. I'm gonna have you hold that arm still. We're gonna give you a little bit of a pressure and a pinch. Ready? 1, 2, 3, and pinch. This one's a lot harder to see that picture because of the angle of where the needle comes in from. Depth, but you can see the motion. That's our inject aid right in there. I got news for you.
Okay.
We're done.
We're done.
Are you disappointed?
I'm just getting food.
I know, right?